echocardiography might become a relevant surrogate endpoint in heart failure, as illustrated during ESC 2011 by an Italian team which demonstrated, in a study of more than 600 resynchronized patients, that echocardiography improvement 6 months after the beginning of CRT was a clear predictor of long-term prognosis.
The main result regards about the identification of predictors of all-cause mortality in this patient. And specifically, we firstly tested well-established prognosticators in heart failure. Then we tested clinical response and echocardiographic response together with these factors, and we found that only echocardiographic response was independently associated to all-cause mortality.
In particular, the authors have shown that a patient with a bad electrocardiographic response after 6 months of CRT had 3 times higher risk of death within the next 3 years than a patient with a good response. During the clinical trial update session, Jean-Claude TARDIF presented important new echocardiographic findings from the SHIFT study. SHIFT has been one of the key ESC 2010 trials, with results presented in the hotlines by Michel Comagda. 6,500 patients with moderate to severe heart failure, already receiving optimal therapy including beta blockers and having heart rates of 70 beats per minute or more, were randomized to receive either Ivabradine or a placebo. The results have shown a very significant 18% reduction of cardiovascular deaths and heart failure hospitalizations with Ivabradine. SHIFT-Echocardiography was conducted on 611 patients.
The results, I think, are really pretty spectacular. There were significant reductions in ventricular volumes, improvement in ejection fraction, and this was over and above what you get with a beta blocker and a RAS inhibitor. When looking at ventricular volumes, there was basically a decrease of approximately 11 milliliters in both left ventricular and diastolic and systolic volume with Ivabradine. This favorable change was in fact parallel with reductions in heart rate. We were actually able to link the magnitude of LV dysfunction as defined by echocardiography with future outcomes. So there's a very nice story between the magnitude of LV dysfunction, clinical outcomes, and then the improvement of LV function and volumes and improvement in clinical outcomes.
In the SHIFT Quality of Life study presented during an ESC 2011 clinical trial update, the evolution of the Kansas City Cardiomyopathy Quality of Life questionnaire was evaluated in 1,944 patients at baseline, 4 and 12 months.
The Ivabradine group reduced their heart rate, but this was also related to a higher scoring in health-related quality of life. Both allocation groups did improve, both the placebo and the Ivabradine, but the Ivabradine improved significantly more.
Percutaneous mitral valve treatment might be an interesting new option for patients with severe heart failure resistant to cardiac resynchronization.
And we suspect that the reason why they're still symptomatic is related to the fact that they have a severe mitral regurgitation which has not been corrected.
This is what's demonstrated in the Permit Care trial, in which mitral valve repair was conducted in 51 patients who had highly symptomatic class 3 and 4 heart failure despite CRT.
We thought that the functional mitral regurgitation can be fixed by placing a clip on the valve. We have physically measure that a significant reduction of the quantity of regurgitation from the ventricle to the atrium, and this effect is not an acute one, so right after the procedure, but is maintaining and staying and getting better over time. Most of the patients, they do feel better, significantly better, they could walk again, and the functional class was 1 to 2 in about 70 to 80% of the population, and this was also achieved at a relatively low price of death rate,